Hello and welcome to the Healthcare Huddle video podcast. I'm your host, Rachel Slawson, and today we are talking about conflicts of interest within healthcare. I'm going to be speaking with Nicola Gurr, who has written an article titled Concerns over Conflicts of Interest in Healthcare. Have we learned nothing over the past 2 decades? This is available on the Melius website. I will leave a link in the description so you can go and check that out. It's really, really interesting reading, so I would definitely suggest it. It was prompted by the first Do No Harm, the report of the Independent Medicines and Medical Devices Safety Review, led by Baroness Cumberlege. We have covered this whole report within another episode of the Healthcare Huddle, so I will leave a link in the description so you can go and check that one out. I definitely suggest it. It's really, really good and covers the whole report. This article was prompted by theme 7, which was conflicts of interest we deserve to know. So Nicola, hello and welcome. How are you?
I'm grand, thank you. How are you doing?
I'm good, thanks. I'm really looking forward to this because I think it's a really big topic at the moment, and I think you've got some really interesting things to say about it. First, I think we should discuss about what is a conflict of interest.
So a conflict of interest is where there could be an external influence on someone's decision making, and it does have an impact in health. So for a health example, it would mean that a doctor, for example, would be prescribing a drug that he has links to that pharmaceutical company. So the drug may be best for the person, or it may not be. So conflict of interest is both an actual and perceived. So it can be both ways. And that element of doubt, whether is that drug the right for you, or is your competitor's better for that patient, that seed of doubt is where the problem starts.
Yeah, and that makes sense. Yeah, definitely. And you want to know about that before you potentially commit to anything, particularly if it's a medical procedure. How widespread is it in health?
So that's a big unknown, and that's half the problem. The 2 key reports that were published this year, the Cumberlege that you've referred to, that Darren did a very good presentation on, covered quite a few aspects of conflict of health, but also earlier on in the year, there was an investigation into a surgeon called Ian Patterson, and a lot of that report concentrated on some of the conflicts of interest there. So these are only 2 examples, but the fact that they're, the 2 big reports so far have cited conflict of interest as an issue does kind of beg the question of how widespread it is. I doubt these are 2 isolated cases, so I have a feeling it could be quite widespread. However, the NHS is aware of it, and each NHS hospital and healthcare provider has to publish self-declarations by the clinicians into what their interests are. However, what that doesn't say is if a person is working across providers, either across NHS providers or between a private and an NHS provider. So they're in silos, and that's half the problem, is that a patient, if they knew to go and have a look at a register online, would be able to only see what they're doing for that hospital.
Don't we need clinicians to work with drug companies to get new and improved drugs?
Working with innovation and drug companies and device, manufacturers of devices as well, is a key thing to expand health and to improve. But there's a balance, isn't there? So you have to be able to say to patients, this is something I've devised and I think it works, and we're doing the tests, versus, this is so brilliant and of course it will save you. It's a really difficult balance, but there has to be transparency, there has to be honesty.
And I think from reading the Cumberlege report, it was particularly around devices. It seemed to me that devices weren't tested quite as, the process to getting a device out is slightly different to drugs, and it doesn't appear to me to be quite as rigorous.
It's also hard if you're going to operate on someone and open them up, as it were, and put in a mesh in this case, you have to know that you're doing it safely. So how do you test it blind? How do you put in a product that is the control product? So there's those kind of ethical questions as well, about you have to kind of do all the things you can do before you get to a patient, and then you have a leap of faith. But the patients should still know that it's not as tested as other things, or hasn't been on the market for the last 30 years or whatever. So it's all about telling the patient what to expect and what the downsides are as well as the upsides.
How do the regulatory organisations get their expertise?
So that's really interesting. And so one of the things that Cumberlege highlighted is that the regulatory bodies need the expertise from industry so that they can assess things from a knowledgeable point of view. So you need to have that expertise to be able to advise whether they're safe or not. You're not having independent reviewers, you're having expert reviewers. So one way around it would be to have a panel from each of the different drug companies, but then you're potentially harming commercial interests so that the competitors know what's in the drugs. So again, we're back to quite sort of complex balances between how can you regulate from a point of knowledge without being detrimental to the drug companies or the pharmaceutical companies. And the other interesting that Cumberlege highlights is the fact that independent panels who again coming in to investigate things have their own internal balances between conflict of interest. So when Facies Mellis has done investigations, they're very, very careful about who their investigators are, and they're very aware of any conflicts of interest. Human behaviour is a key element in many of these things because clinicians desperately want to do their best for their patients.
Is it just an issue in hospitals or community providers?
So no, it's not just in hospitals and community providers. Conflicts of interest is a perception as well as an actual. So it can happen at all levels of health and health provision. As I said, expert panels as well. So it is quite a broad range. And the thing about GPs, which is slightly different, is that they are their own independent companies. So unlike hospital consultants and consultants out in the community who are employed, GPs run their own businesses, and that's one of the key differences.
So we have decided to split this into 2 episodes, so I will leave a link in the description so you can go and check out the opposite episode. So if you want to go and check out Nicola's article, you can go and find that on the Facies Mellis website, which is facies-mellis.org.uk, and I'll put a link in the description so you can go and check that out. If you're joining us on YouTube, please like and subscribe so you can get notified of our next episode. Thank you so much for listening to the Healthcare Huddle podcast. Stay safe and we will see you next time.